Hi, thanks for coming to this page. I'm Ian Newton, I'm Sue's husband and practice manager. I have probably met most of you either in person or we've spoken on the phone. So this is a special message from Dr. Newton about a new clinic model. Now there's a couple of things that we can be certain about in life. One of those is change. Patients come and go, doctors come and go. We are relocating back to Brisbane. It's really where our heart is. The things we want to do are there, the opportunities we want are there. And Dr. Newton has taken up a new role in Brisbane that she's really excited about, but she also wants to maintain care for her existing patients. She won't be taking on any new patients at this time. The other thing we can be certain about is you can't please everybody. So for those of you who this new model doesn't suit, we would recommend that you go and see your pharmacy, local compounding pharmacy, and ask for a recommendation to a doctor in your area who can do the bioidentical hormones. Now we'd be sorry to see you go, but you have to do what's best for you. Now for those of you who are happy with this model, I'll explain how it works. First up, you're going to get some information, and it's going to be a couple of pages. The second page is really just some, more information about bioidentical hormones, but also it's an authority to continue your care using this new model. It's the way we have to do things in 2018. So that will be something that you fill out and return. That will be a once-off return. The other page will be something you will get on a regular basis for each consultation. And consultations will not be done in the manner before by phone. They will all be done via email. You'll receive a form that looks a little like this. This is a work in progress. And there'll be several boxes. One of the boxes says, I'm happy with my current hormones and the relief of my previous symptoms. So that means that when Dr. Newton gets your blood test in, as long as everything is fine, she will simply prescribe again the same hormones. You may have ticked the box, I'm happy with my current hormones but would like a trial reduction in dose. So you're simply asking there that you want to reduce your dose so that Dr. Newton again knows that she's going to change your prescription, your next prescription. This will also be on the back of a pathology form. Always a blood test will be required, and then you get your hormones prescribed. The third box is I'm having a problem with, and then if you are having any difficulties, then you would list those there. And those difficulties would be things that pertain to bioidentical hormones. And so again, Dr. Newton can adjust your prescription to remedy those problems you're having. Now, the focus is on bioidentical hormones. Anything outside of that area, such as vitamins or thyroid problems or just general run-of-the-mill problems, will still be attended to by your GP. There are other boxes there just simply reminding you to to have a mammogram, to have a breast screen, or for the men to have prostate tests. There'll be little reminders there. There'll also be a box on there for your credit card number. So the process would be you will have a blood test that will come back to Dr. Newton. You will fill one of these forms in, which you will have been sent, and you tick the appropriate box. It comes back. Sue will sit down and do an assessment. Now these assessments will generally be done within 7 days of receiving one of these. So we recommend that when you fill your last script, when the pharmacist reminds you that you're on the last repeat, well then it's time to book in and get your pathology done, and so that we have that in plenty of time so Sue can do this so that you don't run out of hormones. If you leave it right till the last minute, well, just as now it often happens, some people will have a gap in their hormone treatment, and that's easy to avoid. It's really just a matter of when you get the last script, the last repeat, soon after, get your pathology done, fill this form in and send it back, and we'll be able to look after this. Now, if you had done telemedicine in the past, the standard consult was $80 and there was nothing back on Medicare. It wasn't possible to do that. If you saw Sue in person, the standard consult was $80 unless it was lengthy, and you got $37 back. The flat rate for any services now is $40. All services will be conducted in this manner through the email process, and there'll be $40. The bottom line is you will still be properly monitored for your hormone levels via pathology. You'll be able to express any changes that you want via this form, and your prescriptions will be sent out in exactly the same way, sending a copy to you, and the original copy goes to the pharmacy of your choice. So in that respect, nothing will change. This brings in a certain benefit, is that you do not have to make scheduled appointment time, so you don't have to try and find time to get to an appointment. You'll just send the information off, and you will get your information back, your script, within 7 days, and you'll just be automatically billed, and so you don't have to do very much. Now, for those of you who like that convenience, it's obviously going to be very suited. For those of you who like come and see Sue in person, unfortunately we can no longer offer that, but she can offer you the ongoing care that you need with your hormones. And because of the nature of the hormones is all around pathology testing and proper reading of those results, your results will be exactly the same. So Dr. Newton looks forward to your ongoing care, and should you decide that this isn't a model that suits you, she wishes you the very best. We both wish you the very best in your future health and well-being. Thank you. I'm Ian Newton.